औज़ुबिल्लाहिमिनश्शैतानिर्रजीम बिस्मिल्लाहिर्रहमानिर्रहीम। मोहतरम दोस्तों और सुनने वालों, जैसा कि आप लोगों को मालूम है कि आप लोगों की रहनुमाई के लिए मैंने लॉन्ग केसेस की हिस्ट्रीज़ के बाद अभी शॉर्ट केसेस का सिलसिला शुरू किया है। शुरू करने से पहले एक अच्छी बात याद रहे कि सक्सेस इज़ नॉट फाइनल, फेलियर इज़ नॉट फेटल, इट इज़ द करेज टू कंटिन्यू दैट काउंट्स। सो कीप गोइंग, कीप वर्किंग हार्ड। आज के सिलसिले का शॉर्ट केस का टॉपिक है कोरिया। कोरिया में आपको पॉसिबल कमांड आ सकती है, दिस चाइल्ड इज़ हैविंग एबनॉर्मल मूवमेंट टू द जीपी एंड रेलिवेंट। सो द बेसिक स्टेप्स इज इंट्रोडक्शन, consent, exposure, hand sanitization. This is followed by the general look like sick, child is sick or well looking, cyanotic or is cyanotic, having respiratory distress at rest or not. Is there any pallor or jaundice? What is the nutritional status of the child? Diagnostic and dysmorphic features. Then at the foot end, check the respiratory rate. Then hands, sign of the pallor, pulse, milkmaid sign, and pulmonary erythema. Now just I'm telling you about the milkmaid sign.
Chorea tends to hyperpronate the upper limbs when attempting to maintain extended posture. The motoric resistance in chorea manifests as milkmaid's grip, in which the child relaxes his grip of Fidon, as if he is milking a cow. This is a case of Sydenham's chorea in rheumatic fever. It is common in girls. Onset is common in 5 to 15 years and is
And this is a classic sign of pulmonary erythema. After that, go for the head. See the alopecia for SLE, temperature, jaundice. Then in eyes, see the jaundice, pallor, nystagmus. Look for the KF rings and telangiectasias. This is how the KF rings look like. This is how the telangiectasias may look like. Now, in the mouth, look for the darting tongue, oral ulcers. This is the darting tongue sign. See the child is not able to keep the tongue in mouth, he's trying to get it inside and out. And here milkmaid sign is again visible in this thing. It's an unaffected arm, the child is holding it properly. Look, the right side is the child is not able to move. And this is the milkmaid sign, classic milkmaid sign. Then you go for the cerebellar signs, check the tone, then do the finger note nest test, dysdiadokinesia, heel shin test, pronator test, and spooning of fingers. So this is the dysdiadokinesia. This is how the normal patient is doing, and there is a normal examination, and now it will show us how the abnormal findings, which is called dysdiadokinesia, in which the patient will not be able to perform rapidly alternating movements.
Just hold it there. As long as you can. Close your eyes now. Close your eyes and you just hold that there. You hold it there as long as you can. As long as you can. You hold that there. Hold it as long as you can. As long as you can.
Now this is the pronator sign. See, the left arm is moving to the pronating.
Just hold it there as long as you can.
Classic example. Followed by look for the cardiovascular system, murmur for rheumatic heart disease or rheumatic fever. Then in the abdomen, check for the liver, spleen, and ascites. It can be due to CLD and SLE. And in the lower limbs, check the tone, bulk, power, and reflexes. I have made a hypothetical description like I have examined 12 years old boy having obvious choreiform movements with milkmaid signs, spooning of hands, and pronator signs are present. There is a darting movement of tongue and hypotonia of limbs. There is no jaundice, no cerebellar signs, rash, or oral ulcers. The examination of CVS abdomen and joint is normal. What are the differential diagnosis of SID? These movements, these are a couple of few differential diagnoses like Sydenham chorea, which is a manifestations of rheumatic heart disease, Wilson disease, SLE, drug induced, like such as the drugs like levodopa, phenytoin, valproate, carbamazepine, phenothiazine, tricyclic antidepressants. And again, sorry for the repetition. What are the labs for Wilson disease? It can be asked. You tell the examiner that some of the labs will be for the diagnostic and some will be supportive purposes. The diagnostic labs include the ceruloplasmin and copper, which is low. 24-hour urinary copper normal is less than 40 microgram per day. In Wilson, it is greater than 100 to 1000 microgram per day. Then there is a histamine challenge in which two doses of histamine 500 milligram 12 hours apart are given. Liver biopsy in which the 2250 microgram per gram of the dry copper weight. For SLE, you have to do anti-DNA, NNA, ESR, CRP, anti-stone, anti-smooth muscle antibody, and the biopsy is also done along with the clinical criteria. Treatment is haloperidol 0.01 to 0.03 mg per kg per day in 2 DOI doses. Phenobarbital is a drug of choice 1632 milligram oral in the 3 DOI doses. Chlorpromazine 0.5 mg QID. So these are the drugs, and you can check the doses again. Always check the doses. So I thank you very much for your listening, and you can join. I have started a WhatsApp group. You can join the WhatsApp group through this, in which we will have a discussions, and any queries of yours will be answered in that. So I pray that may Allah be our guide, protector, and helper. Best wishes. Allah Hafiz.